Hold on to your headphones. It's time for Spilling the OT with your hosts, Charlie Chatterbox Thompson and Sam the Connector Collins. So, let's dive straight into today's session.
Hey everyone, and welcome back. Today we're going to be doing a deep dive into the world of social prescribing.
Ooh, that's a good one.
It is, right?
Yeah.
So social prescribing, we're looking at this idea of connecting people to like art classes or volunteer groups as a way to improve well-being, not just relying on meds. Kind of think outside the box, look at all those other aspects that contribute to our health. And so I know some people listening might be thinking, well, duh, isn't that just common sense?
Right.
But the way it's being talked about now, especially with using this word prescription, is causing a bit of a stir.
Yeah.
And that's what we're going to unpack today with the help of our expert. Welcome.
Thanks for having me. I'm excited to dive in.
Yeah, I am too. So to kick things off, can you give us a little bit of background on social prescribing? Like, where did this idea come from?
Yeah, you're right. The idea itself is not brand new,
Right.
but the term social prescribing has really gained traction, especially in the UK. So they have their National Health Service, the NHS, their big public healthcare system, and it's actually in their big healthcare plans now, formally.
Wow.
So that gives you a sense of how seriously they're taking it. Now, this might make it seem like a very British thing, but these ideas are relevant no matter where you are, where you live.
Right.
Because we're all dealing with these complex links between our health, our lifestyles, and our communities.
Yeah.
So yeah, the principles apply everywhere.
It's kind of like they're taking something that's familiar, things that make us feel good,
Totally.
but they're putting it into a medical context.
Uh-huh.
But that's what we want to talk about today.
Yeah.
Why all the fuss about this word prescription?
Yeah.
Does it really matter that much?
It really does. I think so. Think about it this way. Imagine your doctor, you go in and your doctor prescribes a gardening group for you. It suddenly feels less like a choice, right? And more like, kind of an order you have to follow, you will garden and you will like it. And that's where this whole idea of power dynamics comes in.
Okay, I'm starting to see where you're going with this.
Yeah.
Tell me more about these power dynamics.
Sure. Think about who traditionally holds the power in a healthcare setting. I mean, generally it's the doctor, right? They're seen as the expert. They're the ones with the authority to, write prescriptions.
Right.
So when you start using the same language for things like joining a choir or volunteering, it can subtly reinforce that power imbalance,
Right.
even if the intention is good,
Oh, for sure.
even if everyone's trying to help.
Yeah. It's like the language we use almost shapes our perception of who's in control.
Exactly.
Even when we're talking about things that seem pretty casual, like joining a walking group or something.
Yeah. Exactly. It frames the whole thing in a certain way. And to understand how this plays out, we can look at this theory called the theory of institutional work. Basically, it says that the specific language we use can actually change how organizations operate, like in this case, the NHS, and also how power is distributed within those organizations.
Oh, interesting.
So one very concrete example of this is how the UK appointed a GP, so a general practitioner, basically a family doctor, as their national lead for social prescribing. So right there, the message
That's
is,
cynical.
yeah, it's medical. It's coming from that top-down perspective, and it might not be intentional, but it shapes the whole way social prescribing is viewed and rolled out.
Yeah, I see what you mean. By putting a doctor in charge, it kind of sends a message that social prescribing is still within the realm of medicine.
Exactly.
Even though it's about, connecting with your community and engaging in things that bring you joy and all that.
Yeah, totally. And if you look at how they often measure success, it reinforces that medical focus. It's all about things like, did it reduce the number of times people went to the doctor?
Oh, interesting.
So the focus is still very much on the healthcare system itself,
Right.
Not necessarily on the person's overall well-being,
Yeah, it's interesting. Hearing all this, it makes me think, isn't this what occupational therapists have been doing, forever? They've always been about helping people find activities that support their health and well-being. So why is social prescribing suddenly getting all this attention now?
You've hit on a really key point, and it's something that a lot of occupational therapists are grappling with. OT has this long history of understanding the link between what we do and how we feel. And there's this framework called doing, being, becoming, belonging, which is super central to occupational therapy.
Oh, like that.
Right. And it emphasizes how being active and connected shapes our well-being.
Right.
So when social prescribing comes along, it can feel like, wait, haven't we been doing this all along?
Yeah. So is this just a case of old wine in a new bottle? Or is there something more to it?
That's the million-dollar question, isn't it? Some folks argue that using the word prescription makes the whole concept more acceptable to healthcare systems. Kind of fits with their existing ways of doing things, diagnoses, treatments, prescriptions. But, and this is a big but, this framing could also have some downsides. We have to be careful about that.
Like what? What are we potentially missing here?
Well, for one, it oversimplifies things. Just prescribing an activity doesn't mean it'll magically work for everyone. I mean, imagine being told to join a choir when you absolutely hate singing.
Oh, yeah, no, not for me.
Right. That's not going to boost your well-being.
No.
It might actually make you feel worse. So it really highlights the need to go beyond these surface-level solutions and really understand what works for each individual. What are their interests, their values, their goals?
Yeah, exactly. Like you said, it can't be a one-size-fits-all approach.
Right. We need a much deeper understanding of why these activities work, why they make a difference. And it's not just about measuring their impact on healthcare costs or doctor's visits. It's about the whole person.
Yeah, it's like we need to move away from this checklist mentality. Did you take your prescribed dose of gardening? And focus more on the individual's experience, how they're feeling, what they're learning, what they're gaining from it.
I love that, the prescribed dose of gardening. It's a great image, and it's so true. It's about moving away from that rigidity and really tapping into the individual's journey. And that's where, I think occupational therapists can really shine. They bring this whole holistic, person-centered perspective,
Right.
understanding that well-being is about so much more than just ticking boxes.
It's about the whole picture.
It really is.
So it sounds like occupational therapy could play a crucial role in making sure social prescribing is implemented in a way that truly empowers people. Not just kind of like here, do this and you'll feel better, but really understanding the individual and their needs.
Absolutely. It's about being that advocate, that bridge between the world of healthcare and the world of meaningful activity, and helping to ensure that the connection is genuine and supportive and truly beneficial for the individual.
Yeah, I love that. So we've talked a lot about, the theory behind social prescribing, the potential benefits, and also some of the challenges. But I think what our listeners really want to know is, how does this actually work in practice? What do these programs look like? And how are they impacting people's lives? We're going to dig into all of that after a quick break.
All right, so we've established this whole social prescribing thing. It's more nuanced than it might seem at first glance.
Definitely.
Let's get down to brass tacks.
Yeah, let's.
How does this actually play out in real life? Can you
Okay.
give us some examples of what these programs look like?
Absolutely. One of the things that makes social prescribing so interesting is that there's no one-size-fits-all.
Right.
There's no single blueprint.
Right.
It can look really different depending on the community
Yeah.
and the needs of the people that it serves. Okay, so paint us a picture.
Okay.
What might this look like in, say, a rural community versus a bustling city?
Okay, so imagine a rural community center,
Okay.
and it's a hub of activity. They've got gardening workshops, cooking classes, group nature walks,
Love it.
you name it, right? And they might have a dedicated link worker
Okay.
who's kind of a familiar face in the community,
Okay.
someone who knows the ins and outs of what's available and can really connect people with the right resources.
Well, it's like a personalized matchmaking service
That's a great way to put it.
for well-being.
Exactly.
I love that.
And then, in a more urban setting, think about like a busy healthcare clinic.
Okay.
And they're partnering with local organizations to offer a whole menu of activities
Right.
that are tailored to their patients' needs.
Okay.
So this could include things like art therapy groups, mindfulness sessions, even job training programs.
Wow.
Right there in the clinic or nearby.
So it's really meeting people where they're at,
Exactly.
both literally and figuratively.
Adapting the approach to fit, the unique context of each community and the diverse needs of the individuals within it.
Totally.
But with all this flexibility, how do we make sure that everyone has equal access?
That is the question.
Right. Because not every community has the same resources
You're absolutely right.
or opportunities.
That's one of the biggest challenges with social prescribing is making sure it doesn't inadvertently perpetuate inequalities.
Right.
We have to think about things like transportation,
Yeah.
language barriers,
Yeah.
cultural sensitivity.
Right. And we talked about the risk of social prescribing reinforcing existing power imbalances.
Yes.
It seems like this accessibility piece is crucial to avoid making those inequalities even worse.
100%. And that's why it's so important to have diverse voices at the table when you're designing these programs.
is.
You need input from community members,
Absolutely.
people with lived experiences of the challenges that you're trying to address.
For sure.
Representatives from different cultural backgrounds, making sure it truly reflects the community that it serves.
Yeah.
But how do we know if it's actually working?
Ooh, good question.
Right? How do you measure something like this?
It is tricky.
Yeah.
Because how do you measure something like improved well-being
Right.
or a stronger sense of belonging?
Exactly.
It's not as simple as tracking blood pressure or cholesterol.
This sounds like a job for OTs,
It does, doesn't it?
right up their alley.
Yeah.
This is where they can really step in and use their expertise.
Totally, because they're really skilled at assessing those more nuanced aspects
Yes.
of health and well-being that go beyond traditional medical measures.
Exactly. So we're talking about moving beyond just like, did you go to the doctor less?
Right.
And looking at, has your sense of belonging increased?
Exactly.
Have you discovered a new passion?
Exactly.
Like that.
It's about capturing those intangible but really valuable outcomes.
Nice.
Right? Like those things are hard to measure, but they matter so much.
They do. They really do. But how do we gather that information?
Yeah.
It's a lot more subjective
It requires a different approach.
than just counting doctor visits or something.
It might involve having conversations with people,
Yeah.
listening to their stories,
Mm.
understanding their experiences in their own words.
Right.
And, OTs are particularly skilled at this kind of qualitative assessment.
Yeah.
They're trained to look beyond the surface
Absolutely.
and uncover the deeper meaning behind people's actions and choices.
I love that, it's not just about collecting data.
Yeah.
It's about building relationships
Mm-hmm.
and understanding the individual's journey
Exactly.
in a holistic way.
Totally.
But, as we're talking, I'm realizing this goes way beyond just the healthcare system.
It does.
Social prescribing seems so intertwined with all these other factors
It is all connected.
that influence our health,
Yeah.
right? Like if someone is struggling to put food on the table
Mm-hmm.
or find stable housing, joining a book club might not be their top priority.
It might not be the thing that they need in that moment.
Right. So it really highlights that health is influenced by so much more
So much more.
than just access to medical care.
100%.
It's housing, it's food, it's all of it.
It's your environment. It's
Yeah.
your social connections.
It's everything.
And it's all intertwined.
And that's where it seems like social prescribing could be transformative
Yeah.
if we do it right.
If we do it right.
It's not about offering a Band-Aid.
Yeah.
It's really about acknowledging the interconnectedness of all these factors.
Yeah.
Social, economic, environmental,
Mm-hmm.
and working to create a society where everyone has the opportunity to thrive.
That's the goal.
Not just survive, but thrive.
Exactly.
And this is making me think back to that doing, being, becoming, belonging framework
Yes.
that we touched on.
I'm so glad you brought that back up.
Could you unpack that a bit more for our listeners?
Absolutely. So this framework was developed by an occupational therapist named Ann Wilcock.
Hi.
And it really emphasizes how engaging in meaningful activities,
Yeah.
feeling connected to others,
Mhm.
experiencing personal growth,
Yes.
and having that sense of belonging are all essential for well-being.
Love it.
And when you think about it, social prescribing, when it's done well, can really touch on all of these aspects.
It's like creating the ideal conditions for people to flourish.
Exact.
To discover new things,
Yeah.
build relationships, and feel that sense of purpose.
Yeah.
But I'm curious, if we really want social prescribing to live up to its full potential,
Mm-hmm.
shouldn't we be more intentional about the language we use?
That's a brilliant point.
I mean, we already talked about prescription
Mm-hmm.
and how that can be a little bit iffy.
Yeah.
Is there other language that we could be using instead?
Yes, absolutely. The language we use really shapes our perceptions, our actions, and ultimately the outcomes that we
Mhm.
achieve. So let's delve into this linguistic landscape
Let's do it.
and explore how we can use language as a tool for positive change
I'm excited.
in the world of social prescribing.
It's kind of wild how much weight a single word can carry,
It really is.
Like we've been talking about social prescribing, and it has so much potential, right?
Yeah,
But then that word prescription, it's almost like it's undermining the whole goal.
it is.
So what are some other words that we could use that would maybe shift the focus back to the person?
I think language that emphasizes agency
Mm-hmm.
and collaboration.
Yeah.
So instead of prescribing activities, what if we talked about connecting people with opportunities
Oh, I like that.
or facilitating their engagement in things that are meaningful to them? It's a subtle shift, but I think it can make a big difference.